Hello friends, welcome back to my channel. Today we are going to discuss the topic portal vein. Now whenever we refer to a portal system, it means that the blood vessel rises in a set of capillaries and ends in another set of capillaries. So the hepatic portal vein, commonly known as just the portal vein, is what we are going to discuss today. Is the liver. Here is the duodenum. And here lies the pancreas. And this is the spleen. So the portal vein begins here behind the neck of the pancreas by the confluence of two major veins, that is the splenic vein. This is the splenic vein coming from the hilum of the spleen, and this is the superior mesenteric vein. Now both these join here behind the neck of the pancreas at the vertebral level L1 or the transpyloric plane. Now the site of formation of this portal vein is important and it is often asked in various MCQ exams. So once it forms here, the portal vein runs upwards and slightly to the right. But as it ascends, it passes behind the first part of the duodenum and then it goes upwards till it reaches the porta hepatis, where it divides into its two terminal branches. So here we can see that the course of the whole portal vein can be divided into three parts. The one lying below the duodenum, this part near its formation, is known as the infraduodenal part. The part lying behind the first part of duodenum is the retroduodenal part, and this part is the supraduodenal part. Now we study the relations of these parts in various regions. So first, talking about this infraduodenal part, the anterior relations are here the neck of the pancreas, and posterior to it lies the inferior vena cava. Now this part, the retroduodenal part, the anterior relation would be the first part of duodenum along with the gastroduodenal artery and the common bile duct, and posterior to it again lies the inferior vena cava. Now the relations of the supraduodenal part are very important. They are that anteriorly lies the hepatic artery and the common bile duct. The common bile duct lying to the right and anterior, while the hepatic artery lies to the left and anterior of it. The posterior relation is again the inferior vena cava. So we have seen the relations of the three parts of the portal vein, and now we shall see its branches first. So here, as I told you, before entering the liver through the porta hepatis, the portal vein divides into two branches, that is the right branch and the left branch of the portal vein. Now we shall see the various tributaries of the portal vein. So first and foremost, we'll talk about these two, which are the formative tributaries. Number one, the splenic vein, and this one, the superior mesenteric vein. Now it is also important to know here that the inferior mesenteric vein drains into the splenic vein, hence it is an important tributary of the splenic vein, and the inferior mesenteric vein in turn is a continuation of the superior rectal vein. So these two veins will also be a part of the portal system. It is important to know all the tributaries of the portal system because it is often asked in all MCQ exams, your pre-PG exams and USMLE part 1 regarding the various tributaries of the portal system. Okay, so number 1, splenic vein, superior mesenteric vein, inferior mesenteric vein, which is a continuation of the superior rectal veins. Now coming to the tributaries of the trunk over here. So here lies the stomach, and from the trunk arise two veins, that is the left gastric vein and the right gastric vein, both of which are important tributaries draining the stomach. Also, a vein known as the superior pancreatico-duodenal vein joins the main trunk of the portal vein. Now we have already seen the left and right branches. So a branch draining into the left branch of the portal vein is the para-umbilical vein, and a branch draining into this right trunk is the cystic vein. So cystic vein and para-umbilical veins, both of which are tributaries draining into the right and left branches. Then from this left gastric branch, in fact the left gastric branch drain a few esophageal branches draining the lower part of the esophagus, and draining into the right gastric branch is a vein known as the pre-pyloric vein of Mayo. So here we have enumerated all the important tributaries of the portal vein. I hope you have understood them well. In my next video, we shall discuss about the porta-caval anastomosis and as to what are the complications of these anastomosis. Thank you for watching.